Before all this, I was an athlete. I ran, I swam, I cycled. I would, run twice a week. I did Pilates. I would swim 2 miles once a week or twice a week. I was a teacher, a mother, a wife, and overnight I woke up and I felt like none of those things. It started with a runny nose and just some malaise, just not feeling well. And instead of getting better, I got worse. So went to the doctor. I was diagnosed with pneumonia and given a prescription for an antibiotic. And then about 36 hours later, that pneumonia had gone septic. I think I had like a 10% chance of survival. And what happens when you go septic is your organs begin to fail. And what they had to do is give me blood pressure medications that were so strong that it forced the blood into the failing organs. And when that happens, your extremities, the blood, is no longer in your extremities because it squeezes your blood vessels very tight. Mm-hmm. And the more flexible your blood vessels are, I guess the more blood can leak through, but mine were very, very tight. Mm-hmm. And the end result was we were facing amputation of both of my feet.
When I first had the privilege of meeting Martha, she was still in the ICU. She was on the ventilator. She was very ill. Even from the beginning, she was more than willing to work with therapy every time they came.
There's just something about someone's aura, and you notice something about someone. You really can tell about their spirit. And Whitney was someone I trusted. I didn't trust anybody, and she was someone I trusted.
We began with doing, range of motion exercises in the bed, moving her arms, moving her legs, helping her try to sit up on the edge of the bed, which may sound simple, but she was very weak. She was very sick. It was really hard for her to even sit up.
She said to me, we're going to sit you up on the side of the bed, and I'm thinking, I've got this, and I'm going to get up and I'm going to go home. And they sat me up on the side of the bed. I was still on a ventilator, and I felt like a human rocking chair. And I've been doing Pilates for 3 years prior to that, so I had a strong core. And that was the beginning of my realizing how very ill I really was.
We progressed slowly to walking in the room, to walking in the hallway with a big platform walker. Ultimately, before she left the hospital, she was walking with a rolling walker outside on the sidewalk. She was going up and down stairs. We were getting in and out of the bed from different heights. And she went to acute rehab when she left here to continue her therapy.
If at all possible, when you're working with someone in physical therapy, that you find someone that you trust, someone that motivates you and that you feel comfortable with, because I think that helps you to move forward as well. You sure have your own cheering section. I just want to end each day with a sense of accomplishment, and it's actually easier for me to do now than it was before, because my accomplishments, although the tasks seem small to many, they're great. They're just great. I'm just like, wow, look what I can do now. I can kneel down to the floor like a normal person. I just want to end each day with a sense of accomplishment and maybe even adventure. So I think of things as adventure, new experiences for me. Everything's a new experience on new feet.